Andrew here, and talking about Ottawa conference. I had the pre-conference workshops on Sunday, and I want to chat a bit about Monday, which is day one. So it started with a great plenary from Ian Martin, who's from Deakin University. He was talking about really AI. He's got a doctor and technology kind of background. He also has a great team at Cradle, which is an acronym for some digital and technology enhanced education stuff. He talked about the benefits of AI with self-directed learning with instant feedback being able to be offered at any time. He also said, don't run away from AI. Follow the principles of authentic assessment, so matching up our assessment with the actual practices of the profession. And that's been a bit of a theme of saying, if ChatGPT can pass certain exams, then are those exams actually fit for purpose? Are they actually examining what doctors can do? And if a chatbot can answer them sufficiently, then it may not be an appropriate exam. It's a really good principle. There's also some stuff he talked about with assessment integrity. I've got the slide which I'll put up there, which I thought was really interesting. He also talked about the concept that different technologies have been very disruptive or thought to be controversial when they come out. So Photoshop was a big thing when it first came out, and you could really edit the quality and enhance the quality and certain features of photography. And so there was this mood of going, using it Photoshop versus not using Photoshop. Now you wouldn't question that. You would see that as a standard of the industry, using a Photoshop type editor to enhance and bring the best out of your photography is just normal. And we think probably that's the way that AI will go in healthcare and healthcare education soon. And ultimately, AI can't replace wisdom, as he called it. So that ability to distill not just knowledge and facts, but the relationship and the different factors into a really unique context or situation. That's the thing that is the most valuable in health professions, and that's the thing that would be best assessed. So that was good. I was going to go to a session on remediation and coaching. It's so popular they had to turn people away, so I wasn't able to go to that one. Instead, I went to some really interesting workshops on empathy. So they talked about how do we assess empathy. Probably the upshot was that we need to assess it in lots of different ways with multiple assessments, and getting patient or standardized patient feedback as part of that, and how they felt and their suggestions for improvement would be really valuable. We also talked about how we don't ever question teaching things like the cardiovascular system or assessing cardiovascular system, but as soon as we talk about assessment and teaching empathy, it's kind of seen as something that's either controversial or as an optional extra rather than a core competency and a core skill, which I would see that as the latter. And talked about empathy being integrated into teaching and assessment rather than always seen as something separate. Thought that was good. Really interesting session on student mental health and how its impact on obviously progression and fitness to practice, and how just having a mental health condition shouldn't be a barrier to passing, neither should it just be a cover-all excuse for getting out of assessment requirements. So like treading that path carefully and getting advice as necessary. They talked about having a psychiatrist on every fitness to progress or fitness to practice kind of board to leverage some of that expertise. It's not a bad idea. Overall, less stigma with mental health, more people being open and reporting their mental health diagnoses, increasing complexity of people having multiple mental health conditions that might overlap, also with neurodevelopmental disorders like ADHD and autism all coming into the play. These things add to the diversity of health practitioners that we're graduating, but it can factor into unique needs and sometimes difficult journeys through the university pathway. So it was really interesting to talk about that. Ultimately, mental health conditions don't excuse all behaviours, and you need to line up with what specific impact for that specific student does a certain condition have at a specific time. That was a useful takeaway. Then communication skills. There was a really interesting thing with putting ISBAR handover into an OSCE. We do that in Adelaide Uni, which is cool. and having an oral. Oh yeah, they had oral case presentations done on video recordings in Montana, which has apparently a population of only about a million people for the whole state, and so a lot of their stuff is rural and remote because of that. And so they did a series of video oral presentations that were assessed by the same 3 specialists centrally, and that worked quite well and had more consistency in and measure or reliability in measuring the students' progress than the individual supervisor assessments that were done throughout the rotations. And there was even a VR OSCE demonstrated from Malaysia, which was really interesting. Communication and feedback was the last session that I attended. So feedback, communication and feedback was the plenary. Feedback on communication skills specifically at the end of the day, which is great. There's a number of challenges. I've taken a picture of the slide, which I'll put up here for your interest. They were saying that a skilled communicator applies the correct set of communication skills to each context and encounter. That will showing that there's complexity with communication skills, and that it sometimes makes it a bit more challenging to assess as well. And in terms of communication feedback, it can be tricky because it is often tied to this esteem and identity of the learner or the practitioner, so that can make it a bit more of a vulnerable area to talk about. It's seen as a soft skill, and so therefore it can be less valued by some areas, particularly those that are very procedural heavy in their practice. And it can be very context dependent and needs to be flexible. So those were the things that I took away from that session. Enjoying day 2 at the moment, and I'll give you an update on this soon. Hopefully some of this is thought-provoking and interesting. See you soon.